Tonight, U.S. syphilis cases are rising, including congenital syphilis. And doctors warn they're struggling to find a crucial antibiotic, and that includes here in our valley. I spoke today with the CEO and founder of PS Test, Dr. Phyllis Ritchie. Dr. Ritchie, first off, in light of the national spike in syphilis cases, what are we seeing here locally?
Hi, Peter. Thanks for having me. So locally, we're seeing a spike of cases, but they've always been relatively high here. They've been rising since at least 2013 in Riverside County. So we see a constant rate of cases in Coachella Valley, mostly in gay, bisexual, and other men who have sex with men.
Why do you think we are seeing a spike?
Well, it's interesting. It seemed to happen between 2017 to 2021. We started seeing the spike. So it was pre-COVID, and there has been a deterioration in our public health department. We don't have enough money from the government, et cetera. And the National Coalition of STD Directors has asked the federal government for $1 billion to put into more funding, because if you break down the public health department, of course, you're going to have big problems.
And why are we also seeing an increase in congenital syphilis?
So congenital syphilis has increased 11 times in the past decade. 20 years ago, syphilis period was almost gone. And as of 10 years ago, there's been an 11-time increase in congenital syphilis, and it's for various reasons. Again, that breakdown in the public health department. We used to have people go out and find mothers that didn't get health care, test them, and treat them if necessary. The other problem is drug use. Drug use is a problem because mothers don't come in and get their prenatal care. And the third problem is lack of providers, lack of places where people can go and get tested and treated. The big problem in all of this is Pfizer announced in June that it has a low rate of making bicillin. And so we're really low on bicillin, and bicillin is the only medication used to treat congenital mothers who are pregnant.
So then, in light of the lack of bicillin and the shortage, what are clinics doing?
Well, we are still giving our last bits of bicillin until we run out. The government wants us all to keep it for women that are pregnant, which is difficult because the treatment otherwise for people other than women who are pregnant is doxycycline twice a day for 14 to 28 days. Heck, I have a hard time taking anything for 7 days, let alone 14 to 28 days. So we still try to give patients the bicillin's the best treatment, but doxycycline is another option for people that aren't pregnant.
Do you anticipate we'll see more cases of syphilis?
Yes, I do, because I don't know if people are taking their whole course of doxycycline. Again, the women that are pregnant on drugs and aren't getting prenatal care, they may not get treated, their partners may not get treated, and this will just continue on and get transmitted.
All right, Dr. Ritchie, as always, we appreciate your time. Thanks so much for joining us.
Thanks, Peter.